Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors.
Hello, and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hey all, Dr. Santhosh here, pediatric infectious disease doc and a researcher.
And we're back. It's season 10. I mean, if this is your first time listening to us, hi. Hello.
Hi, welcome. We're
But if
10
you
years old. Yeah.
with this many holds up digital fingers.
So Josh doesn't do pediatrics, and so he doesn't know that 10-year-olds can say they're 10 years old without having to show you on your fingers. But we are totally this many. Yeah.
I'm excited. Like we've
I'm
been
so happy.
we've been
I,
doing this for a decade.
yeah, and thanks to all of you folks for, listening to us and, giving us feedback and, getting our brand new ebook, which is available if you decide to join our awesome mailing list. And yeah, you folks keep us going along with our absolute love of nerdy medical knowledge.
So it's made everything so exciting that I think I feel my blood pressure going up a few points.
You've got a little bit of feeling of like, Russian, blood to your head with a little bit of a buzz and a headache and all
I,
that fun stuff.
I'm so excited and I just can't hide it.
Is that the one you're gonna pull the, what do you call it, the cord, and the water's gonna fall on you? Is that the right movie, Flashdance?
My blood pressure's out of control and I do not like it. Woo!
Oh God! Wait, are you doing one of your famous Dr. Dworetsky segues into our topic for the day? Even though our listeners have more than likely gleaned what it is by looking at your punny title.
Well, I figured we're coming back and we need to open season 10 with something big, something that everyone can relate to, something that about 15% of the world's population has.
Oh dear,
And
that's a lot of
that's
percent.
one of my favorite from the hospitalist hat trick, high blood pressure, not high cholesterol
Yeah.
or diabetes. Just
Yes.
just blood pressure. So it's the devil on your shoulder, the wormwood to your denethor, it's the gateway disease that leads you to other more complex diseases.
Yeah.
It's gone by nicknames from hard pulse, hypertension, Bright's disease, and as one of the oldest problems, surely we must know what causes it, right? So the number
Well,
one cause is essentially
yeah.
hypertension.
Essential. Exactly. It is. It is essential. And yeah, if all of you out there are listening thinking that that tells you nothing, yeah, go with that feeling. It's
All right.
Josh.
What if we
That,
called it
that, yeah.
primary hypertension instead of just what is it?
Yes. Oh,
Essentially
yeah.
hypertension.
I mean, we could confess our knowledge, in the best way possible and call it, idiopathic, which just sounds absolute
Because
like
what idiot named this pathology?
this is all to say that this is one of these diseases, and just like you said, Josh, thousands of years, studying this disease from different angles. But essentially, haha, we know that there are many different reasons that a person gets to the point of having high blood pressure. We know that it's variable. We know that there's many different causes for one person that feed into it, eventually making you hypertensive. But we have no way of unifying all that knowledge and being like, Here it is.
So 15% of the world's population of what, like 8 billion people has
we're
hypertension.
we're coming up on eight going on nine.
And of the people who have it, that 15% of the world population, so let's just say 1 billion,
Sure.
uh, 95% of all cases in humans are this hypertension of unknown cause. The remaining
Yeah.
5%, usually kidney or endocrine disease, and the ones we can explain, less interesting, so we just call those secondary hypertension.
Yeah. Exactly. So you can either have primary or essential hypertension, or you can have hypertension secondary to. I actually like to think of high blood pressure more of like a symptom rather than actually explaining the disease itself. And that helps me wrap my mind around it. But I know we're going to talk about it more in a bit, Josh, but what happens in essential hypertension is multiple factors coming together to put you in a situation where there is basically stress on the pipes, right? So, all the bad things that you can do to your arteries by putting too much flow and pressure to them that could cause them to tear, get a clot, all these kind of things. That's what the problem is. And essentially, we don't really care about the hypertension itself. We care about what it eventually does to you.
So, how long have we known about it? Well, I usually don't dust this off until later in the season, but
Yeah, yeah. You have
Santosh,
to ease people into, this depth of your
if
nerdiness. But yeah.
if you wander around over here underneath this large shapeless cloth,
Oh my
uh,
God.
we can hip hop in the Wayback Machine.
Oh, man, this is brings back some memories. Ha! Get it? Because it's way. I'm
No,
sorry.
it brings memories back. Bring
All right, Josh. Well, tell me who's back again.
so. Oh my God, we're back again. Podcast listeners, everybody say
Yeah.
that the oldest documented actually is from 2600 BCE,
Oh.
and that's over in Asia. The Chinese Emperor's Classic of Internal Medicine notes
Mhm.
that even back then, if too much salt is used in the blood, the pulse hardens.
Oh.
So, and treatment of hard pulse disease included things like acupuncture, venesection, or cutting veins open, or bleeding by leeches.
Yeah, and they're talking about something that we still use to this day as symptomatic diagnostic criteria, where
Santosh, if you're doing that to this day, you may need a new primary care doctor.
no, no,
Your blood
no,
pressure's
no,
a
no.
little high.
Sorry,
Let
sorry.
me get a shot of leeches.
I'm gonna take it one at a time. No, okay. I do not put leeches on anybody. This, and nor do I cut open veins. I am not a vascular surgeon. No, no. The first part of it, talking about a hard pulse, this is one of the best ways, and it does happen in later stages of hypertension, but as the arteries actually harden with atherosclerosis and the pressure gets higher and higher, when you put your fingers to the pulse, whether it's on the wrist or on the neck, on the jugular or carotid or any of these areas, one of these symptoms that you'll feel is the pulse smacking, really hitting hard against your fingertips. And you have to, examine a lot of people to understand what soft and hard feels like in terms of pulse. But that's a beautiful description right there from, you know, 4,000 years ago, Josh?
Well,
Little less than 4,000 years ago?
if you want a nice description, we can go out to 1500 BC and take
Oh, nice.
a look at the Ebers Papyrus. That's
Wait,
right,
Josh.
ancient Egypt. First episode of the season.
Oh, ancient Egypt! Yeah. Wait, I don't think I've asked this question before. Our Wayback Time can move through time and space. I mean, I guess it would have to, but
Legally, I can't say.
oh, okay. But we are. I mean, we did hit the switch and move up a thousand, maybe 1,100 years to 1552.
Listen, the world's in
In
an orbit. Let's just assume we show up where we need to be.
all right, take us to ancient Egypt, Josh.
So, reading the Ebers Papyrus, uh, one of the oldest medical records from, well, ancient Egypt. It
Yeah.
states, "To know the movements of the heart and to know the heart. From the heart arise the vessels which go to the whole body. If the physician lay his finger on the head, neck, hand, epigastrium, the arm, or the leg, everywhere the motion of the heart touches him, coursing through the vessels to all the members. When the heart is diseased, its work is imperfectly performed. The vessels become inactive so that you cannot feel them. If the heart trembles, has little power, and sinks, disease is advancing. If you examine a man for illness in his cardia, and he suffers from pain in his arms, breast, and one side of his cardia, death threatens him imminently." Which just, wow. Not a
Yeah.
lot has changed.
Oh, but well, I'll tell you one thing's just changed, man. Medical journals nowadays need to read like that. This is boring ass text that we write out of, it's, that's so it's poetic. It's so gorgeous. It's so good.
And it pretty accurately describes low blood flow in things like heart attack or possibly stroke,
Right.
even atrial fibrillation.
Yeah, and so this is the opposite, right? They're talking about when the pulse is becoming weak, and so this would be when your peripheral blood pressure, the pressure going out to your body and your arms and your legs, is getting weaker because the heart is unable to pump, or possibly other reasons. But this idea of to know the movements of the heart, from the heart arise the vessels which go to the whole body, and you can find the heartbeat everywhere. Like, this is such a beautiful observation. No echocardiograms, ultrasounds, any of this stuff, just an excellent clinical exam to tell you if your patient is sick or not. I love it.
And we even can jump up to 1000 AD when
Mhm.
Avicenna, or the Arabian physician poet Ibn Sina,
Yep.
just, I'm only mentioning him because there's a great line in there about the pulse.
Okay.
Differences in pulsation mean illness and causation, which is
Oh
way better than correlation and does not
yeah.
imply causation.
I really like that. Yeah, yeah. So they're telling you, in this case, differences in pulses. So either it's changed from, you've seen a patient before and their pulses have changed, or even in the same patient, if you feel a difference in pulse from right side to left side or something like this, there's pathology somewhere, because the pulse should be fairly even throughout the body, especially symmetrically. So that's so cool. I'm sure it's even more beautiful in like the original Arabic. But yeah, I love that day and age. And we do have some folks who are like this now. They are doctors and poets. But I personally feel that to get back to good medicine, our science writing has to get back to some poetry, man.
So, if we've known just from palpating the pulse that we can estimate or predict the blood pressure, when did we start paying attention to it as an entity of clinical importance, do you think?
I mean, it sounds like all the way back to the Chinese Yellow Emperor's Classic. They knew it was a problem. They knew, and we would have to have standardization and measurements of pressure and things like that before, like a sphygmomanometer or something. The blood pressure cuff thingy could be invented.
So,
Is it something like that?
we had to kind of work our way through the ancient history of high blood pressure first, and
Okay.
it was originally, and not incorrectly, believed to be a disease of the kidneys.
Okay.
So
Oh, okay.
after hard pulse disease, the next nickname wasn't until 1836 when Richard Bright noted a link between diseased looking kidneys and
Mhm.
cardiac hypertrophy, or muscular overgrowth of the heart.
Oh,
And
okay.
he saw this in so many patients that he had the pathology named Bright's disease for his trouble. So, diseased kidneys with muscular heart.
Uh,
Now,
so wait, so he actually, 'cause usually diseases are named in honor of, like, so someone will name it after their mentor or something like that. He just went up and like, this is mine.
It's my disease. You can
Yeah.
have it. Well, you can have it, but you don't want it.
Yeah, exactly.
In 1850, George Johnson came to the rescue in defense of Bright, suggesting the lesions and changes seen in the kidneys were actually an adaptation to elevated blood pressure. So, a
Oh,
feature,
okay.
not a bug.
Gotcha. Okay, so as the way we sometimes think about it now is that as essential hypertension proceeds apace, then it starts affecting the end organs, such as the liver, kidneys, heart, etc. So you're seeing the consequence rather than the original cause.
But this became a real chicken and egg debate, and it took a Indian physician, an English physician of Indian descent,
Okay.
who was one of the first to incorporate blood pressure evaluation in the clinic, and that is Frederick Akbar Mohammed. Um, and he suggested high blood pressure could exist without renal disease, that it could cause rather than result from. So you can have normal looking kidneys and still a diseased heart or vessels. Now, the sphygmomanometer, and isn't that fun to say?
I go ahead and listeners, if you want to either pause, say it out loud a few times, especially if you're in the car, and you just want to, you know,
Here, I'll,
or,
I'll cue it. I'll cue it up for you. Do 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 do. Sphygmomanometer. Do 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 do.
all
I
right, yeah,
dare you.
rub that a
I
few times.
I dare you to think of it any other way now.
All right, little pause, and welcome back, all you wonderful people who just, repeatedly shouted sphygmomanomenon out into the ether.
Sphygmomanometer by Italian physician Scipione Rivarocci.
Oh, okay. So, no, okay, well, let's bridge that. So the actual sphygmomanometer was invented by this doctor.
Rivarocci in 18
Yeah.
in
Okay.
1896
Yeah.
finally had a external means of measuring blood pressure largely by cutting it off, and
Oh.
you would look at the cuff pressure at which you could no longer feel a pulse because you had created a tourniquet upstream. That's great, but Santosh, we always talk about the lub and the dub and different sounds you hear when checking the pulse, and those
Yeah.
weren't discovered until 1905, almost a decade later, when
Oh. I mean, I'm
Russian
sure they were like they were described before, like the beating of the heart, but they weren't kind of like systemically described or systematically described until then.
when Russian physician Nikolai Korotkov described the sounds heard when you listen to an artery with a stethoscope while the sphygmomanometer cuff is deflated.
Oh, okay. So the original intent of the stethoscope, of course, to listen to the heart. I can't remember the wonderful physician who invented it, but I remember him writing that poetic scene about putting his ear against the chest of a well endowed woman, and he had to find a way to better examine the heart, and so he came up with the stethoscope. But he took that tool and he said, hey, what if I auscultate, what if I listen to the pulses but in a different spot, and
Let's
follow the vessels that come
let's
from the
be honest. He invented it to listen to a heartbeat and lungs through a lady's bosom, and then
yeah.
he started saying, "I wonder what else I can put this on if people are unsuspecting." I'm listening to everything. I can hear the human body. But we're
That's
talking
awesome.
about blood pressure. Whenever we are talking to patients, or if you're watching television and somebody has gone to a medical clinic, what's something that television doctors and their real life counterparts almost always tell people on a standard visit?
Take down your pants. It was cough. You can cough. No, I'm
All
not
right,
getting
let's
close.
let's let's
Have a
focus
seat.
maybe on lifestyle changes.
Oh, yes, yes, yes. So universally, right? Eat fresh fruits and vegetables, more fresh fruits and vegetables, less processed food, and exercise. Yeah,
Yeah, and
easy.
the less processed food is usually because you want to decrease your salt intake.
Right.
Now, would you say there is a link between salt And blood pressure.
So I remember I went to medical school from 2003 to 2007. And I remember that this was still a matter of debate. And I'm sad to say, because I went into pediatrics afterwards, and we have a different workup and everything of high blood pressure in kids. So I lost the thread of what has happened so far with the evidence
Oh, I mean,
between.
it's been pretty well proved since 1904.
Oh, okay. So it's okay. So I thought, okay, the other things that I heard about and stuff probably were like pop medicine and stuff like that, that was stupidly trying to refute the evidence. Okay, got it.
I mean, we'll get into normal blood pressures in a moment, but in
Yeah.
in France, 1904, Ambert and Boujard were the very first to prove there was a link between sodium and blood pressure. And because this is about the Frenchest study I could possibly imagine,
Okay. All right. Go ahead.
they spent 3 weeks
Uh-huh.
studying just 6 patients with high blood pressure, and they
Yeah.
varied the intake of salt by giving them 3 diets. So
Okay.
each pair of patients got a diet while these French guys were sitting there smoking cigarettes, holding baguettes, wearing berets, and drinking wine. And the
Stop
three
it.
diets included
Yeah.
very little salt, but 2 liters of milk and dairy products per day. So a lot of
Sheesh.
cheese. The
Okay.
second had a little bit of salt, but in addition to the 2 liters of milk, had a bunch of protein, meat, and eggs.
Okay.
And the third consisted of 2 liters of milk plus 2 liters of broth containing 10.5 grams of salt.
10.5 grams?
Yep, for 3 weeks.
Okay, just to let everybody know, and maybe we'll talk about this a little bit later. I think our USD recommended is measured in milligrams. I think it's 2,000 milligrams or 2 grams, right? In one day.
Yeah, so 10 grams of salt. Well, and this is because in the early 1900s, the theory of high blood pressure was believed to be protein toxicity or protein excess.
Oh,
So
okay.
these guys kind of proved a link with salt accidentally, and they measured it by estimating the amount of salt excreted in the urine each day.
What?
You know,
Also,
that's they probably just peed more out than they brought in. Um,
well, I mean, they okay. Oh, gotcha. Okay, so they didn't do an actual thing where, because I think back then you'd have to boil off the urine and then measure the salt content in
Essentially, they
grams.
noted that the salt group had a higher blood pressure when they were expecting to find the low protein groups with lower blood pressures.
Oh, got it. Okay,
So this didn't come up again until the 1920s
okay,
when researchers Allen and Sherrill described 180 patients with severe blood pressure who were
okay,
given a low salt diet but normal protein.
yeah,
And the blood pressure in 20% of them came back to normal.
okay.
And in 42% of them, the amount of blood pressure drop was sufficient enough to be regarded as therapeutically successful, whereas complete failure occurred in a third of them. So a third of
Oh,
people, no effect on blood pressure from low salt diet. Just under a third, a normal effect or complete recovery, and just under half, enough to say that there's been a difference. So
yeah.
then Bright's disease became salt nephritis.
Oh, gotcha. And I do understand. I'm going through a little bit of my reasoning and my mind, what I'm thinking of. So this proved a very strong correlation and association with salt intake, leading to high blood pressures and pathologically high blood pressures. But at least for some, it wasn't the whole story, because they cut their salt and they still had high blood pressure.
Well, decreasing your salt was the fad diet of the 1920s and 30s and done
Ooh,
with
okay.
about as much effect as fad diets today, meaning it had its proponents, but by and large did not have replicable results.
Yeah.
So
Well,
The
the lore carried on all the way, right? Because even when we were kids, Saturday morning cartoons and that kind of stuff, because you'd have the, the toys commercials for the kids and then the adult commercials, not adult like that, but like for grown-ups and stuff, you would inevitably now with low salt.
It looked like in the early 1930s, people had given up on a link between salt and blood pressure.
Okay.
And this was the case until 1948, where researcher Kempner had devised a diet to treat high blood pressure that was low in fat, contained 20 grams of protein, and less than half a gram of salt per day. I'm going to save you the trouble of thinking what that would look like, and it was rice and fruit.
Oh,
And
okay.
this
All right.
diet was so low in salt that the 24-hour urinary excretion at the end of 2 months was
Yeah.
usually less than a quarter gram. So
Oh,
less than you would shake onto a meal in a modern American diet
yeah.
was put out in the urine at the end of 2 months.
Yeah, yeah, yeah. So essentially, the 2 grams per day that we think of in a full grown adults, around 70 kilograms, they 70 kilogram weight for the adult, not the amount of salt. But yeah, we think about that 2 grams because 2000 milligrams or 2 grams is about how much we lose. So our suggestion is just replace what you've lost. And so if you're talking about like 250 milligrams or 0.25 grams, that is a very small number.
And again, this was an accident. He was trying to show that high blood pressure can be lowered by low protein. That's why 20
Sure.
grams of protein. And he didn't want to admit that he had, beyond any shadow of a doubt, proved that low salt can do it. So he had the effect of his diet on 500 patients and published it. And he has chart after chart that shows falls in blood pressure, chest radiographs showing a decrease in heart sizes, which, if you have an overgrown, muscly heart
Mhm.
from having to pump all that blood
Yeah,
up
that's not a good
through
thing.
your
Yeah,
body,
yeah.
uh,
Right.
or EKGs that showed rhythm abnormalities, which you can see with an overly swell heart,
Hmm.
would revert to normal, and even photographs of damage in the retina where you have microcirculations that can be damaged by high pressure that had improved. So amazing results. He also, however, made no mention in his report of complications associated with such rapidly induced reductions in salt intake. And
Sure.
the only reason he was so successful is he collected all the urine excreted every day from each patient. If you
Okay.
recall, 500 patients.
Yeah.
So by the time he saw them in the ward, he knew exactly how much salt they were excreting, and therefore he knew how much they had eaten. Oh, Mr. Johnson, I see your pee. Someone had an extra slice of mashed potatoes today, right?
So this man went OCD on the urine, just like, and then would shame his patients
Oh,
into,
the
maintaining their
paper
diet.
was great. Kempner's reactions when they had aired were
Yeah.
such that the patients were unlikely to air again.
he pee shamed his patients.
I told you, no
Yeah.
more salt.
Yeah.
Checking the urine every single day.
So this is, it's post World War II, Geneva Accords and everything, but I would put this under not terribly ethical. When you want to genuinely find the effect and you don't want to confound stuff, you shouldn't be going in and pressuring your subjects and stuff to be complying.
Au
And it's,
contraire. Au
oh,
contraire, mon frere.
okay.
Because, again, we as a nation were not taking blood pressure seriously, despite the fact that it had been proven time and time again to be linked to low salt. People were like, all right, so salt can lower your blood pressure. Who cares? What's the big deal about high blood pressure?
Right, right. And that's the problem, right? It will go on for decades before it causes consequences.
So, if we're in the era around World War II, I want you to name me a figure who had massively untreated high blood pressure that ultimately led to their death.
Oh, okay. Are we going with Hitler?
No.
No.
No,
uh,
he was vegan. His blood pressure was
oh
probably
no, he
fine.
was just fine. Was it what? Can you tell me? Was it on any of the other world leaders?
Well, yes, or this would be a much less interesting podcast.
Was it our president?
It was Roosevelt.
Okay. Oh, Rose. Oh, FDR. Okay.
So
So,
Roosevelt was first diagnosed with high blood pressure at age 54,
okay.
uh, which went untreated for at least 4 years when he got massage therapy and phenobarbital for a blood pressure reading of 190 over 105 in
Wow.
1941. Um, that's pretty high. We
Yeah.
don't
So,
like that as doctors.
and we're okay, and we're going with rather than salt and everything else like this, and lifestyle changes. We're trying to massage the because with this high blood pressure, almost 100%, there's going to be jitteriness, and you're going to feel horribly crappy and frenetic and all this kind of thing. So they're trying to massage it away, and then the phenobarb, I'm guessing, was for the anxiety part of it, but in general, as a downer, it probably had some marginal effect on dropping the blood pressure a bit.
So in 1945, at the Yalta Conference,
Okay.
Roosevelt was noted to be in failing health with heart failure, shortness of breath, lethargy, and drowsiness. So it sounds like maybe some obstructive sleep apnea, heart failure, complications
Oof.
of high blood pressure. But how high could it be? Oh, 260 over 150.
You're so full of crap, Josh. That's
Physicians, we don't like that.
yeah. That's that's beyond hypertensive emergency. Like that person would, if you triage that person in the ER, they'd get sent straight up to the ICU.
On the morning of April 12th, 1945, Roosevelt
Yeah.
reported a severe headache while sitting for a portrait session. He subsequently lost consciousness and died with a blood pressure of, oh, where was 300 over 200.
Josh, this is the blood pressure in an elephant or a giraffe. Like this is insane. Wait, hold on a second. Hold on. Normal blood pressure of a giraffe. Yeah, 280 over 180 is a giraffe.
We had actuarial data from insurance companies since the
Yeah.
1930s that
Hmm.
showed the relationship between high blood pressure and mortality from heart or kidney disease. But
Yeah.
it wasn't until Roosevelt died as a result of all these complications of high blood pressure that management became more widely practiced and people started focusing on control. Before then, there were very few drugs, and most of them were poorly tolerated. So you had strict sodium restriction, the Kempner diet, with
Yeah.
somebody collecting your pee and yelling at you like Hell's Kitchen. You
Yeah.
had pyrogen therapy, which is just let's inject some bacteria like typhoid and have you sweat the blood pressure
Sweat
down.
it out. Yeah, okay. Very
You
heroic,
you
yes.
had, oh well, this is a fight or flight response, so let's just start excising your nervous system with a
Oh.
sympathectomy
Oh, okay. And
and
okay.
adrenalectomy.
Oh, jeepers. Okay. Okay.
And you had sodium thiocyanate, but toxicity and marginal effectiveness kind of limited its use.
Yeah, as in, so for those people who don't know, the thio part is a sulfur compound, and cyanate is, yeah, it's a cyanide compound, and it would eventually break down into cyanide. It had a therapeutic window, but it was quite narrow.
So, not surprisingly, when oral diuretics were developed in the mid 1950s, and the first one was chlorothiazide called Diaril, a diuretic pill. It's catchy, it's simple. Way to go, madmen.
So,
But
yeah, for those folks who don't know the lingo, Dr. Josh is not saying like diuretic, like making um, diuresis, or so dia is the Greek, I believe, which is kind of meaning to like go through. So that's what diarrhea is. It just passes right through you. So dia and uri, so diurea or diuretic would be something that makes the urine pass through.
Not surprisingly, when these oral diuretics were developed, they increased excretion of salt through the kidneys, and
Okay.
this was considered a satisfactory alternative to a low salt diet and a way more convenient way of dealing with the habitual high consumption of salt. So people were just like, oh, I'll just take this salt excreting pill. No need to change my dietary habits.
Ah, damn it.
Like almost from the go.
Yeah, yeah, yeah. Well, that's what we do as humans, right? If you tell me that I have to make, you know, extensive changes to my lifestyle that take effort and all this kind of a thing versus I just have to pop this and oh, this will help. And by the way, you're not going to know, like, right, you're not going to actually know the consequences of this until decades down the road. And who's to say? Kind of a thing. Maybe not decades, years. Yeah.
So we've been dancing around, and before we go back to fun historical facts, let's just talk about what is high blood pressure. I'm going to bet everybody who's watched a television show is shouting or quietly raising their hand, which it's your car or home, folks. It's all right. You can just shout it out.
Yeah, it is. Go for
Uh,
it.
one 120 over 80 is the normal number, I think, that's still tossed around in television.
It is, yeah. That's what we usually hear. I believe that has changed, especially if you start factoring in risk factors. So, if your family history of hypertension is very bad, if there are comorbidities like diabetes, or if you already have peripheral artery disease from eating like crap and not exercising, then that number does change.
So nowadays, I think as of 2017 or 19, the most
Mhm.
recent guidelines say if you're going from 120 to 130 top number and
Yeah,
you're still under 80, you have elevated blood pressure. At risk, not terrible, and that also varies with age. If you're, 80 years old and you have blood pressure of 120, we are dancing a jig as your
yeah,
physicians. Just
absolutely.
thrilled.
Yeah,
If you're a teenager, unimpressed. You're doing the bare minimum. Uh,
yes,
but if your blood pressure starts running with the top number being 130 to 140, that is stage one hypertension. That is lifestyle changes and maybe, depending on your risk factors from family, starting a drug, which
yeah,
likely will be a diuretic,
uh huh,
a water
yeah.
pill. It's going to make
Oh,
you pee. Stage 2 hypertension is a blood pressure systolic, top number 140 to 150, or a diastolic, that's when the bottom number starts becoming important, over 90.
yeah,
Um, that's when you really start seeing more damage to microcirculations, especially if you're forming clots and other conditions like diabetes, little cholesterol plaques, or if you have atrial fibrillation that could be throwing tiny clots. That's stage 2 and above is really when we start worrying about longer term effects of high blood pressure. And if you have a Roosevelt era blood pressure in like 180, 200, that's a problem. We don't like that.
yeah. So we start actually labeling these as different categories altogether, like hypertensive urgency or hypertensive emergency,
Oh, do you know the
where
difference?
Uh, I believe, if I recall properly, that urgency is a certain cutoff of the number, and I don't remember what it is. But emergency, especially, is if you're having acute signs and symptoms of end organ damage. So if you're having headaches, vision changes, you're having heart symptoms, like a chest pain and all these kind of things, along with that high blood pressure and organ damage in your kidneys where they've either shut down. Yeah, so that kind of a thing. But do you have a better definition for me, Josh?
Well, I mean, if you want to get hung up on numbers, 180, systolic of
Okay.
180 or above is enough for hypertensive urgency.
Yeah.
But you're right. It's the presence of end organ damage that goes from urgency, which is, well, that's concerning, to emergency, which is, oh shit.
Yeah, and sometimes the patient can feel it, like, oh, I've got this headache that it won't go away. That's from blood rushing, through your head, or it can be something that Dr. Josh and I find while we're examining you. So we actually take your pulse, or we measure your kidney output, or we use the ophthalmoscope and we look in the back of your eye and we see that there's actually like damage to the retinal vessels.
Oh,
Everybody to kind of be on the same page. Systolic blood pressure is the lub, right? And diastolic is the dub. So what we're talking about is when your heart is actually squeezing and blood is really going through your arteries and everything else like that. That's the top number, systolic. And then diastolic is the phase of the heartbeat when the heart relaxes. And so that's the lowest blood pressure you get to. You should never get too high or too low
uh,
to
I
live.
guess yeah, systolic is the amount of force to squeeze all the blood out of your heart to go where it needs to go.
Yeah.
And diastolic is the amount of relaxation as your water balloon of a heart fills up again.
It is. And you want to maintain that to a certain degree because if your blood vessels don't have tone in order to maintain that bottom number at a certain height for depending on your body physiology and everything, then the most important part, your brain, right? That you should have a consistent flow of blood, that's going to the brain, and that won't happen. It'll drop out, and then you can have, the opposite, low blood pressure, and you have fainting and stuff like that.
So, regardless of what stage you fall in, we often will try and treat to a goal of 140 over 90 or below. So, it's okay. We're not thrilled with people being in stage 1 hypertension, but we like people to stay usually below 140 to 150. That's sort of the
Yeah.
new modern day target range. If you're 120 over 80, fantastic. Um, and of course, there is white coat hypertension, which is the kind of high blood pressure where it's me, hi, I'm the problem, it's me. Just seeing the
Yeah.
doctor and not having a Taylor Swift song playing in the background can raise your blood pressure.
Yeah, absolutely. So, yeah, our blood pressure is supposed to go up when our sympathetic nervous system fires, right? So, we want that blood pressure to be nice and high to maintain flow to all of our essential organs and everything if we're running away from something or so that's actually the kind of high blood pressure we like from time to time when you're getting good exercise and everything else like that. But if you're getting anxious, just, without running area, you're just getting shocked kind of a thing, then yes, temporarily you can have high blood pressure, which is why, Josh, actually, I think we've switched over to, yes, measuring blood pressure when you come to the office, but actually trying to get your blood pressure when you're relaxed, laying down at home is, and then getting multiple pressures so that we understand,
Well,
what you're doing throughout the day.
I usually tell my patients, if you're going to weigh yourself, you're going to take blood pressure. The key is consistency. Do it at the same time every day rather than at various times because people who do not have high blood pressure, and even those who do, your blood pressure has a natural variation throughout the day. When you wake up in the morning, it tends to surge and then it increases throughout the day, peaking, around lunchtime.
Yeah.
And then at night, when you're sleeping, it tends to drop by about 10 to 20%. And for people who have high blood pressure, you have four other distinct patterns. They can have a normal drop in blood pressure when they're sleeping, that's about 10 to 20%, and we call that normal dipping. Then there's those who have extreme or double dipping, which is a drop of more than 20%. That runs into something we call orthostatic hypotension or positional changes.
Hmm.
Then there's those who hardly dip at all, very polite, non dipping, less than 10%. Those tend to be people who have persistently high blood pressure, very difficult to manage. And those who experience, and this is the trickiest one, reverse dipping, where their blood
Oh,
pressure is higher when they're asleep than when they're awake.
yes. And it seems paradoxical and weird, like why should that happen? But we don't understand everything about the physiology of hypertension, but what's happening over time as you're putting pressure on the pipes, right, Josh? You're stressing them and you're wearing them out. But one of the things that our blood vessels do in response over a long period of time is they become fibrosed and stiff. When that happens and you don't have this like nice elastic compliance, that means your highs can get really high and your lows can get really low, and they can switch spots like this. And so, weirdly enough, a symptom of having chronic high blood pressure can be fainting when you stand up, just like Dr. Josh said, orthostatic hypotension, because you actually don't maintain good blood pressure when you change posture from sitting to standing.
It's basically a failure in the wiring. We call it autonomic dysfunction. Your
Yeah,
body has little sensors in the neck that say, oh, when the person stands, we'd expect blood pressure to fall. Let's give it a little boost.
a little
But
boost. Yeah,
someone's asleep at the wheel there.
yeah.
And that's not what happens. And so you get up, your blood pressure falls, and hopefully you do not.
Yeah, yes, exactly. There are a number of things where, of course, we're worried about end organ damage. How does your heart do with high blood pressure, your kidneys, your brain, all these things like this. But Josh, the consequence of this, blood pressure being so high can sometimes be something as scary as, oh, they can't maintain good posture and upright, and or they get orthostatic and they're subject to falls and something, like deadly, like head trauma from a bad fall.
Or you can even have infarctions of muscles or organs
Yes.
like the kidney or the heart, because if your blood pressure is too low, you can't bring all that life giving hemoglobin and oxygenated blood to an area. If a muscle or an organ doesn't get sufficient oxygenated blood, it will start to die off. So, blood pressure too high or too low can be a real danger, and you want to keep it just right. Now,
Right.
here's a fun fact. Uh, Blood pressure or its detection is the reason we allow scientific evidence in court. Uh,
Oh, okay.
wait. No, this was
Okay.
great. So,
All right. Or you should say like non-scientific evidence, right? Because we're talking about stuff that's kind of been
okay,
debunked in
look,
terms.
there's
Yeah.
there's two different standards for whether or not you can admit some kind of scientific evidence into court. This isn't a legal podcast, so
Yeah.
we'll just
Okay.
say there's the Fry standard and the Dobert standard. Um,
Okay. Okay. Sure.
The Fry standard is uses something called the systolic blood pressure deception test. Great name.
Oh. Okay.
Fantastic name. It's a precursor to the modern day lie detector test and based on the idea that blood pressure is influenced by a person's emotions. Now this is true. We know
Yep.
that having, strong emotions can affect your blood pressure. Now, here's where it gets fun. The test claims that lying or deception causes a rise in blood pressure because it requires effort to hide the truth. You have a physiologic response, you become more anxious, your blood pressure rises. The test was invented by William Moulton Marston. Does that name ring any bells for you, Santosh?
Oh gosh. Yes, and I can't remember why. Tell me.
Because
Tell me.
he's the creator of Wonder Woman with the lasso of truth.
Oh, that's right. Yeah,
Now,
because we did this in one of our comic book medicines way back when. Yes, yes, yes.
William Moulton
Okay.
Marston's a fascinating character. He deserves a whole episode just for himself. But
Yeah.
the systolic blood pressure deception test was used in the case Fry versus the United States,
Uh-huh.
and they underwent the test, and then they argued that the trial court erred by not allowing an expert witness to testify about how effective the test was or wasn't. Basically saying this lie detector test is a bunch of bunk. You can't use it to convict me. And because the only person who really knew how to work or read the lie detector was William Moulton Marston, the
Yeah.
jury agreed. So the Fry standard means that science has to be commonly accepted to be admissible in court. And noting the
Oh.
change of blood pressure and emotions was not enough to pass that standard, but it was enough to create the standard. So there you go. Medical legal fun facts. Da 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 da. Plop.
Yay! But yes, we should say right now, according to everything we have in terms of data, the modern day lie detector is a load of crap. So we shouldn't be using that one. But yeah, the biggest problem. with all of this kind of the root of it is that yes, actually, blood pressure does fluctuate when we're angry, sad, emotional, anxious, all these kind of things. But the correlate is not tight enough that you can actually draw solid and sensitive and specific conclusions. That's the problem.
But let's go back to this salt and diet, because I know most of you are picturing in your head someone who's elderly. And by elderly, of course, I mean older than you at home
Yeah.
listening.
Yeah, just wherever you're at. Yeah, yeah,
But in a large study of 750 children, and prepare to be horrified by some of these numbers I'm about to throw out, Santosh,
yeah. Go, go, go.
just a 2-gram reduction in salt intake to a goal of 7 grams a day
Yeah,
induced a significant fall in blood pressure after 6 months.
and
Someone was giving kids 7 grams a day of salt.
oh God, that's so much. I'm. This is unethical.
In a similar study,
Oh God.
in 32 adults, average
Yeah.
age 40 years,
Okay.
reducing salt excretion from 9 grams a day to 4 grams a day caused a significant fall in blood pressure at 12 weeks. Now,
Oh, okay.
so
All
just
right.
dropping your salt by 5 grams a day could change your blood pressure at 12 weeks. So you may be asking, all right, well, what's 5 grams of salt? That's easy to cut out, right?
Because you're picturing a gram is about a paperclip, right? But remember what I said before. The amount of salt that you want and that you kind of turn over in your body and that you want to change out and everything else like that is in milligrams. Okay. So 2 grams, 2000 milligrams, or actually maybe closer to 1500, is a small paperclip and a half
No,
worth
no,
of
no, no,
things.
Santosh. Let's keep this with numbers people can understand.
Oh, okay, sure, sure. Okay.
A hamburger with French fries.
Yeah.
Pick your chain. Doesn't matter. They're all about 5 grams of salt. That's
Yeah.
it. Just one hamburger with
Yeah.
a small order of French fries, five
Yeah.
grams of salt.
Yeah. That's two
Just
two and a half times more like the times that you need in a day.
one less hamburger a day. Blood pressure is dropped at 12 weeks. Fantastic,
Yes.
right?
Oh
Great.
yeah. Huh? Yeah.
Um, in adults age 60 to 78, so we're hitting all our age ranges here: young, our age, old. A reduction in salt intake from about 10 grams a day to 5 grams a day. So, again, the theme is cut your salt intake to about half of what it is. And in the elderly, if they just did it for 4 weeks, they reduced blood pressure by almost 8 points on systolic. That almost brings you down an entire level
Yeah.
from
Yeah.
stage
Yeah.
3 to stage 2 to 1. That's similar to blood pressure lowering drugs just by having your intake of
The
salt.
way that we kind of go for this when we talk to a lot of people, especially on a Western diet, is because of what we talked about, like the burger and fries and everything else like this, is if we can get folks to just stop eating out a lot less and especially stop going for the fast food, however, we're able to do that with the full acknowledgement that, by the way, people are stressed and it's the kind of world that we live in and all these kind of things. But if we can get them to make their own food at home, anything else like this, just like you said, Josh, one of those meals drops your sodium by so much. And it is kind of insane how much less salt you consume when you salt your own foods that you cook at home.
So
Way less.
the bulk of Western societies consume an average of 8 to 12 grams of sodium a day.
So bad. So bad. Yeah.
I don't think you all listening at home appreciate just how much that is.
Yeah. We're talking about anyone from 4 to 6 days worth,
Recommendations are 3 to 6, and
Yeah.
we on average double that.
Yeah, yeah. I personally I go for the proper, like the lower end, like the 2 grams. But I think that's like pie in the sky thinking, so I'll take that back a little bit.
And If you're over 50 years of age, only 20 grams a day for about 3 to 5 days is enough to cause a rise in blood pressure. Whereas in young adults, teenagers and 20-year-olds, they could have up to 30 grams of salt a day for over a week before it was noted to cause a rise in blood pressure. So
Yeah,
there's
and
a definite age with
yes.
things breaking down, getting rusty, I guess.
Yeah, well, what happens is as we age, our ability to actually uh, basically tolerate extremes, whatever it is, lack of sleep, lack of exercise, too much calories, whatever it is. So when we're younger, our abilities to kind of either excrete and dump what we don't want, or kind of deal with all these stressors is much better than as we get older and older. It's one of the most principal basic things of aging. We love salt, we love salty stuff. If you're able to control the cravings and stuff for the salt as you get older, then the fact that your taste buds kind of dull as you get older and you want stuff to be more sugary, salty and things won't bother you as much.
Stop eating now. You can taste food when you're old. Kids today
Yeah.
with their
Okay.
salt. So for those of you who are taking blood pressure medications,
Mhm.
some advice based on studies. Certain blood pressure pills, like water pills or diuretics, are best taken in the morning because they increase how often you urinate and you don't want to be getting up multiple times during the night. If you're on furosemide or Lasix, most of the time that's given twice a day, but it is named because its duration of effect lasts up to 6 hours.
Lay six.
Another study called the Hygeia chronotherapy trial, fun names,
Yeah. Uh-huh.
followed 19,000 Caucasian Spaniards, so Inigo Montoya, uh, with
Yeah.
high blood pressure for an average of 6 fingered years. The results of this study basically had half the group take all their blood pressure medications at bedtime, while the other half took it in the morning. And it found that people who took their blood pressure medications, diuretics aside, at night had overall better control and were less likely to have a daytime cardiovascular event, defined as
Oh,
a heart
okay.
attack or stroke. Um,
Yeah.
those who used to take their blood pressure in the morning and switched to the night had a 44% drop in risk of heart attack,
Yeah.
or 40% reduction in the risk or need of surgery on the blood vessels. Uh, Also, a 49% reduction in stroke. So, if you were taking your blood pressure pills in the morning, you may
Yeah.
want to consider switching them to the evening after discussion with your primary care physician, which is the included caveat in anything that even remotely sounds like advice you ever hear. We are
Yeah.
entertainers,
On this podcast. Yeah.
educating ones.
Yeah. Yes, we will happily be your doctors face to face in the clinic, but on this podcast, damn it, we're here for the ha-has.
Because once we talk about switching your medications tonight, we can also talk about my favorite little used, and for good reason, blood pressure drug from the old era called reserpine.
If I remember that one.
That's because by the time you and I entered practice, Santosh, it had already largely been discontinued. It's
Oh,
one of the few drug treatments shown to reduce mortality
yeah.
in randomized controlled trials. So, the
Okay.
Hypertension Detective and Follow Up Program, the Veterans Administration Cooperative Study, and the Systolic Hypertension in the Elderly Program. But it's still good enough to use as a secondary option for patients who cannot achieve their targets.
Okay.
The daily dose, although it has a pretty high side effect profile, the daily dose is as low as 0.05 to 0.25 milligrams. And the reason I like it is even though it's not really used in human blood pressure medications anymore, it is still used as a long acting tranquilizer to subdue excitable or difficult horses. And that means it's one of the few
Nice.
blood pressure medications you could deliver through a dart gun.
Hey. I was just imagining. the the physician casually sitting behind their desk, just like loading a thing, and it's like, all right, Mr. Smith, guess it's time to start your therapy. So I'm going to give you 10 seconds.
Doctor,
Sorry,
Miss
doctor.
Johnson. Doctor, Miss Johnson is here for her blood pressure appointment. Did she bring her rolling walker? Not
Yeah,
this time. Good,
yeah,
good. Click.
yeah. We know that salt intake and management is a huge part of reducing essential hypertension and all of the consequences of that. Exercise is important, good diet is also important too, but just like anything else, there are going to be other variables and factors that make people less and more prone to hypertension and the downstream effect.
And there are a lot of studies that will link it. So that's where I think we're going to end our very first episode. There's a lot coming up this season. We've got some gamified things. Of course, we're going to have a ton of calls to pop culture. We'll probably work in at least a few interviews or two, and some old faces may come back. So it's the perfect time to sign up for our mailing list, find out when we'll be appearing out in the real world. Follow us on the social media, TikTok and Twitter and wherever people are socializing on media, we'll be
Jo-
there.
Jo- Josh, Josh,
Yes?
did you leave the keys in the Wayback Machine?
Oh no, are we still going way, way back?
Josh, did you leave the key? Josh, the
Alright, I gotta go track down some plagues.
universe is about to implode in on itself. Josh.
So we'll keep this fast. Thanks everybody. Welcome to our 10th season. This show is produced by me with a lot of help from Dr. Santhosh and friends. Our theme music is composed by Rachel Leisure. If you'd like to support us spiritually, emotionally, or financially, links to do that are in the show notes, along with links for further reading, including sources we used for this
Josh,
episode. And I've gotta
Josh,
go.
matter is condensing.